Okay, we are doing cognitive restructuring therapy, and some background information. It assumes that psychological disorders stem from irrational beliefs that cause people to act in maladaptive ways. This specific therapy is designed for depression and says that depression arises from assumptions that people make about themselves. And the therapy is a gentle, non-confrontational therapeutic approach. The goal of the therapy is to identify self-defeating assumptions and change the validity of them and substitute positive assumptions, and attempt to improve the depressed person's negative self-image. Patients after therapy may understand the origins of the disease and be able to apply the skills they learned in their therapy to intervene from negative assumptions in everyday life. Okay, scenario. Sally is a high school junior who is starting the college application process. She has feelings of worthlessness and doesn't feel like she is good enough to go on to college or to do anything for that matter. Every day she thinks about it, she becomes more and more depressed. She thinks that some form of cognitive therapy may help to change her outlook on life, college, and everything else. She decides to start seeing a cognitive restructuring therapist named Dr. Hickerson. Okay, scene 1. Come lay down. Okay, hello Sally, how are you this afternoon?
I'm good. I'm feeling a little stressed out over this whole college application process. It's really, I don't know if I'm going to be accepted.
Okay, and why is that? Is it your grades?
Yeah, they're not too good. I have A's and B's, but mostly B's. So.
Okay, well, those grades seem really great. Why don't you feel that you won't be accepted?
I just hear from a lot of people that it's going to be like really tough to get in, and that...
Okay. But according to your grades, they seem to be above average of what would be accepted for high school admission into a good college.
I guess it's true, but everyone just tells me that it won't be good enough and that people are way better than me. I just don't really have that much confidence in myself.
Okay, I see. Well, I'm glad we've identified the problem. I'll see you next week, Sally.
Okay.
Bye.
Bye.
Scene 2. Hello, Sally. How are you feeling this week?
I'm alright. Continuing to be very stressed out about this whole application process. I've been feeling really down lately, too. Like I'm worthless and just not good enough.
Well, if you were to take a guess, where would you feel that these feelings are coming from?
I don't know. I just feel like I'm not good enough for this, or that...
Like you're always going to fail?
Yeah, exactly.
Okay, I see.
Yeah.
Well, I think we've identified the problem here, Sally. You are feeling depressed due to the false assumptions and beliefs that you are constantly making about yourself and your future.
So how do I fix this?
We're going to work together to disprove these negative feelings that you have about your self-image. Come see me again next week. I believe we are really starting to make progress here, Sally.
Thank you.
Scene 3. 2 weeks later. And how are you doing this week, Sally?
I'm doing a lot better. I got accepted into a couple colleges that I wanted to get into, so I really didn't think I was going to get in.
Very nice. This is why there's no need to get down on yourself, Sally. What you need to do is work on restructuring your thinking in stressful situations, like sending in a college application or taking a final exam. Just tell yourself to relax and that you studied harder than anyone else, or this test really cannot be too difficult. Once you apply this restructuring into your everyday life situations, your depression might start to subside.
Thank you. I guess what you're trying to say is the thought really does count.
Exactly. Believing you aren't good enough is what causes unhappiness and feelings of worthlessness in your life. If you restructure your thoughts and your outlooks on college applications or on life period, you will be much better off in the years to come.
Well, thank you so much.
You're very welcome.
Have a good day.
You too. In the following months, Sally took what she learned in cognitive restructuring therapy and is not nearly as depressed. She has a much better outlook on her self-image, her experience, and life to come. The end.